to help out our healthcare workers. We keep seeing the numbers, thousands of cases, ICU beds are up, hospital beds are up. So we wanted to know, how are our hospitals doing right now? We're joined by Dr. Ross Goldberg, who works at Valleywide Health, the president of the Arizona Medical Association. Dr. Goldberg, thank you for joining us again. It's good to see you. And in your role as president of the association, I know you talk to a number of different healthcare workers. So let me ask you right now, and I've been telling our viewers all along, I'm not as concerned with the number of cases we're seeing on a daily basis. I'm concerned with the number of people going to our hospitals and ICU wards and things like that. So where are we right now in your experience with these beds and ICU wards?
Well, first off, good morning again. Thanks for having me. You're exactly right. I mean, the case numbers can be jarring, the numbers, and obviously we want to track them. But the big thing is who's getting sick enough where they need to go to the hospital or have to go to the ICU. Those numbers are going up. I can tell you from my perspective working in the hospital here, our numbers have been going up steadily. We worry about bed capacity, staffing capacity, and that's not just a concern at this institution, but across the state. When I talk to a variety of our members, they're seeing the same thing.
I can only imagine, and we have our own busy times here at the station, breaking news. Actually, we've been in one for a while, but not like you. After months and months and months of working, I would imagine, long hours, how are our medical workers holding up, including yourself? What's the morale like inside the hospitals, and how are people handling this?
Well, I mean, I've mentioned this before. I'm lucky at my institution, our leadership's been very transparent, and we actually have a pretty good morale. But you bring up a good point. We've kind of been running at a high level for a few months now, and there's only so far as you can say an engine can go. So there is a concern that at some point we could be kind of wearing down. I don't see it right now. And I do appreciate the fact that we have put plans in place. I'm talking about the governor regarding bringing external staff in. We're going to need that because we can only sustain this for so long. So the health and well-being of all of our healthcare workers is just as important. This is why we've been advocating for all of these issues to try to stop the spread of the virus, because we worry about all the healthcare workers taking care of everyone as well.
So what's it like right now inside your hospitals that you have visited? I mean, it's not like we have people in the hallways and things. I mean, I guess I'm trying to get a sense of what it's like when you have these COVID patients in there. Is it a tough working environment? Are people, I mean, you tell me, what's it like in there?
Well, yeah, we don't have anyone on the hallways or anything like that, but I'll have a prop. I'll show you. I'll show you the mask that I've been wearing now because of the patients that we're seeing. So this is the normal mask that I wear. You can either wear it as a P100 or you can wear the N95 when you're in a COVID unit. But it's not just wearing this mask. I wear a face shield, I wear a gown, I wear gloves with every patient encounter now, not just our COVID patients, because of the asymptomatic spread. So we're wearing a lot of gear now. To go into one of these rooms, you've got a gown and glove up, wear all this stuff, go in and then wipe everything down. It's just a lot more effort goes into it now because we have to be safe. It's a lot more PPE, which is fine. We're willing to do it. But again, timing, resources, it gets a little, these are hot things to wear for long periods of time. You've seen the pictures from the last few months of kind of the indentation around the face and kind of how the masks wear down. So it is a lot that we go through. So we're not seeing patients in the hallway. Everyone's got a room. We've got everything allocated up. But again, we're wearing a lot more equipment to go take care of people for safety reasons.
How much worse does this have to get before you are, I don't want to say overrun, but when you're in a critical position there, or are you in one now?
Well, we had talked about the last couple of weeks, we've been in that crisis kind of mode where we have the ability to allocate resources. I really don't want to find out what our ceiling is. We can push and we keep on taking care of patients and we will keep on taking care of patients. You also have to remember that diseases don't go on holidays. So even though we're dealing with a lot of COVID patients, there's everything else we have to normally address as well. And that doesn't go away. So we want to be able to take care of everyone and deal with all the issues. So it really is on everyone's shoulders now to kind of help stem the tide so that we can do our jobs to take care of everyone like we normally do.
When you hear, and I don't know if you see it, and I'm on social media quite a bit, you probably don't even have time to do that sort of thing, but when you see people saying, I'm not going to wear a mask, I'm not going to do these things, people are trying to control me, what do you think when you see people saying those things?
Well, it's very upsetting to see the politicalization of mask wearing. This is not a political issue. This is a medical problem. So I'm wearing this mask, so I'm asking everyone else not to wear this mask, but to wear one of these. This is far more comfortable than wearing one of these. I know it's not the most pleasant thing to do. I understand that. As a surgeon, I'm used to wearing masks for long periods of time. I understand for people who haven't done it, it's not the most comfortable thing, but it really does make a difference. The distancing, the washing the hands, the wearing the masks, these are showing to be simple things that you can do to stem the tide. We're not trying to, notice, I'm not saying you have to do it, though I would prefer it. I'm asking for everyone's help. It really is now, we're asking for everyone's help to support us. You look at us to take care of you when you get sick, and we're happy to do that. We're asking for just a little bit of help here to try to make sure we can keep on doing our jobs. And I don't think it's that big a deal to ask to wear a mask in public and around people so that you don't spread the disease.
And we're out of time here, but one last question. There's no doubt in your mind that wearing a mask is going to help with this situation?
No doubt in my mind at all.
Dr. Goldberg, thank you so much for all you're doing in our community. Thank you for joining us here on Fox 10. I hope to see you again. Let's check in with you if we can in another week or 2 weeks or so. You up for that?
Anytime. It's my pleasure to be here.
All right. Thank you, Dr. Goldberg. All right.